what I'm talking about today is looking at using smartphones to monitor outcomes, broad outcomes for people with a neurological condition living at home. And just in the interest of time, I will answer that question I've asked there and say, yes, we can, and we are using smartphones to monitor outcomes. And I'm speaking on behalf of a big multidisciplinary team based within UQ and based within CSIRO's e-health team. And we have people from health backgrounds, clinicians, researchers, and IT and engineering people who are helping us very much in developing this relevant project. So given we're talking about secrets of the brain, I thought I would clarify which part of that this project fits in with. When you have changes to your brain, you will absolutely see that on tests that are scans of your brain and looking at the chemicals within your brain and so forth. But that's not the part we're looking at. You will see that in the sort of tests of symptoms that doctors might conduct with their patients, and we are going to pick up a little bit of that. But our main focus is how changes to your brain or how a condition might impact the sorts of activities you'd like to do in your own home and within your community. And this study was developed to look at those issues for people with Parkinson's disease. So one of the challenges, or there are many, many challenges associated with Parkinson's disease, and one of the big ones is that it fluctuates. So things will be different from people for day to day, and it will even be different hour to hour. So that makes it quite hard for people to sort of keep track of what's going on for them and also for their medical teams. There are lots and lots of different symptoms happening all at the same time as well. So the motor symptoms you might know quite well, things like tremor and difficulty with walking and moving about. But there's also a lot of non-motor symptoms. So people's emotional state, their gut, how well they're sleeping, what they're able to do, and so forth. And there are some well-known clinical challenges for people with Parkinson's disease, and that's things like getting a diagnosis in the first place, getting enough information to know what's going on to get that diagnosis, and then getting treatments exactly right. Because with medication, for example, too little of a medication and the person is really affected by their symptoms, but too much and they can have disabling side effects. So it's very important to get detailed information as to how things are going. So we wanted to know, could we monitor it from home? And why would we want to do this? As Peter said, we feel it's the most valid and realistic indication. When you travel to see your doctor, this is not how you are most of the time. You might have had hassles with traffic and getting in there, parking might have been a nightmare, you might be terribly worried about it, or everything might be going really well and much better than it usually is at home, and it can be quite hard to demonstrate what's actually happening for you. Being able to monitor how things are going at home also reduces the costs and the burdens of travel. Some people are travelling long distances to see specialists in this case. We're able to get a long period of time, so appointments that you get medically tend to be short and fairly spaced out. So we're not able to get a sense of, well, how is someone 1 hour later and how are they this evening after this change has happened? When you go and talk to your doctor, you are relying on recall in being able to say, well, this is, how I am now is how I usually am, or this tremor that I have is usually happening at these kinds of times, and that's difficult. And if we can find out what's happening with people in a timely way, then we can intervene in a timely way as well. So we asked people, how does your condition affect your everyday life? And this is where we got some interesting information. So where people say, I might have trouble with walking, or I might freeze when I'm walking, they put it in the context. I'm particularly worried when I freeze when I'm walking across a busy road. And we also looked at some logistical things. So you see that we're talking about smartphones. We wanted to talk to people about, are you able to use a smartphone, a touch screen? Do you do it all the time? Are you comfortable with it? How much monitoring is okay and how much is sort of starting to intrude on your home life and your privacy? And this is something that really demonstrates the importance of consumers in research. At APCN, we have a community reference group whereby people who have the conditions that we're researching can be part of the research, can give us advice, can read what we're doing, have a look at the things that we've made and give us feedback so that we're making sure what we're doing is really relevant to people and is able to help them. We do have some forms at the registration desk if you'd be interested in being part of our community reference group. So we asked people what they thought should be monitored. We talked to consumers, health professionals, researchers, and we looked at the scientific literature. And this is how we broke it down. People wanted a really comprehensive approach. It wasn't enough to just look at tremor. People wanted to measure their symptoms. They wanted to look at on and off times, where with Parkinson's this can be a time where the symptoms are really predominating, when you'd expect medication would be able to be helping, but it isn't. They wanted to be able to note clearly when their medication has been taken. We wanted to look at lots of aspects of movement. It is a movement disorder, and all these things are very relevant to see how well someone's travelling. Communication as well. A really important impact from Parkinson's is on how people are able to speak, but also how they're able to choose their words and find their words when they're communicating with other people. And then this last one, which is the part I think is the most exciting, is looking at those big, broad outcomes. So how well people are able to live within their communities and do the things that are important to them. So don't get scared. It's a big diagram. But this is the sort of things that engineers draw to make sure it's all going to work properly. And from my perspective, because we are collecting this data right at the moment, I'm on day 5 of my 7 days of monitoring as a control participant. The person wears sensors, movement sensors on their 4 limbs and on the small of their back. They carry a smartphone that has a custom app on it, and there are beacons in their home as well, just for a period of a week. So people were okay with this really quite comprehensive monitoring as well, as long as it wasn't all the time. So getting it for a week and then coming back and having a look later. The information is encrypted and sent to a secure portal where it's available to the patient so they can log in and have a look at their own information, and it's also available to their treatment team. And we have the architecture, but in the future we'll be able to de-identify and curate parts of that data that wouldn't identify the person and make it available to international researchers. So what are we measuring? Life space, is this a concept anyone has heard about? No. It's a concept we should be hearing about. Life space is the geographic space in which we conduct our activities. So it's something that we can measure with numbers, as in a size, we can measure with locations and so forth. And the way we measure it with a smartphone is via GPS. So the first picture, you can see sort of red areas and yellow and green areas. This is a heat map showing 1 day of somebody's life space. This is somebody without Parkinson's on the far side. And they had about 7 kilometres of travel, 4 different trips. The middle one is somebody with moderate level of Parkinson's, and they had 2 trips and just under 3.5 kilometres, or just over. And then the final one with just that small little dot is somebody with severe Parkinson's who had 1 trip outside the home of 1.5 kilometres. So this is a really good way. We get numbers as well as pictures like this, but pictures tell the story most clearly. And this is a great outcome of being able to get at a glance how somebody's going in being able to go out and about within their community. I should caution that it's not more is better. It's individually relevant to what the trips the person wants to make and so forth. So it's something that we would monitor over time. Now, GPS, if anyone's ever tried to use it inside a building, they would know it's not much good. So inside a building, which is still part of inside someone's home, this is still part of their life space, we use little low-energy Bluetooth beacons, which cover the same ground. So we're able to see how much movement somebody has at home, what different spaces they have in their house, and we're able to log this. So when people record things like a fall, we're able to look at where that's happening. The symptoms and medication. So there's a diary function in the app where people enter their medications. and also enter their off times. So the little pale purple bars are looking at somebody's off times, and the little dashes are different medications that people are on. And that sort of graph is quite interesting to a neurologist in having a look at other timings and dosages right for the medication. People also wanted to be able to measure symptoms of concern. And what was interesting was these were different for everybody. So they might be, for somebody, fatigue might be their symptom of concern, or cognitive fuzziness, so just feeling like you're not thinking very well. And this gives them the means of being able to keep track of that. So when they do visit their doctor, they're able to say, this is how I've been. With movement, with the movement sensors, we're able to do standard tests that are used. So the gentleman is doing a timed up and go there, where you hop out of a chair, walk a distance, turn around, come back and sit down. And you can see the trace at the bottom. We're getting from each limb the movements, and the back we're getting an idea of postural sway. So we're able to have a look at that in standard testing, but also as people go out and about within their community, so what their walking is like. And because we're collecting these things at the same time, we're also able to look at how their walking is at home versus how it is when they go for a walk in the community, and how their walking is when they're recording an off time compared to how it is when they're not. Okay, communication. We have set tasks where people can record aspects of their voice and also have a conversation. So conversations are important for a couple of reasons. One is that when we know we're being recorded and tested, we speak very clearly and as loudly as possible, not how we normally speak to people. And the other is that conversations show that we're able to track the person we're talking to and understand what they're saying and find the words we need to respond. So this is an image from Discursus of tracking a conversation and looking at how people are able to track the content of a conversation. So we're able to also, as well as just ask people, can you have a conversation now? We're able to naturalistically record it. But this is difficult when you're out and about and you might pick up recordings of things you don't want to pick up. And there are people who don't have a conversation partner at home. So I'm going to play a little video of a chatbot.
Hello. How are you feeling today?
Good, thank you.
Great. Can you give me a speech sample?
Sure.
Say, as in car for 3 seconds, please. Thank you.
You're welcome.
Polite people are nice.
Today I went shopping.
Did you buy anything nice?
No, I just went for a look.
You should treat yourself next time.
Okay, so this is a project that's being conducted. People have to, at the end of the conversation, give permission to share it with the researchers. There's a study that's being conducted by the Centre of Excellence in the Dynamics of Language, so keep a lookout for that if you'd be interested in having a chat. It might not have that voice, though. Okay. So we're also interested in how people feel, and this was one of the things that maybe surprised us. We thought people would be most interested in talking about their motor symptoms, but people were interested in tracking things like anxiety. And the way that this is done is we send surveys to the phone every second day, multiple times a day, and people respond to them. They sound slightly stalkerish, where they say, how's it going? What are you doing? Who are you with? How do you feel? But if it ever asks what you're wearing, that's not our survey. We also ask people to keep a diary to account for the 168 hours we have in a week. And this is really useful in tracking how people are travelling and what impact treatments have and their condition has on them. Where it gets quite interesting is we're able to put it all together. So we're able to look at their GPS, in this case, how somebody's wellbeing is, tracking from -3 up to +3, what they're doing at the time they're reporting that wellbeing and where they are. And this is quite useful in having conversations with people about how they want to structure their day and which activities they want to be doing. As I said, we really value the perspectives of the consumer, and we ran a little pilot first We've changed the system a little bit and we're now piloting with a control sample. But in this first pilot, we got some feedback. Channel 9 came and did a story, and I'm going to play a little bit of feedback from a consumer who used it.
For Alison Wright, the app has revolutionised the way she manages the disease.
I've actually changed my medication timing from what we found on the app.
Alicia has also been able to monitor her fatigue.
I've been able to, plan my day better, knowing when I'm going to need that rest.
But those involved are already singing its praises.
Managing Parkinson's is the best thing that we can do until there's a cure.
So, future directions. While we developed this for people with Parkinson's, we see it having value for lots of other groups. We're also currently conducting a study in Sydney that's looking at tracking those passive parts of life space with people with a mild cognitive impairment and dementia. And we think that it's got legs for lots of other groups who are interested in using it. We think it will lead to personalised medicine, so where people are able to say, well, actually, I don't want to track all of those things, but I'm just interested in my movement and my voice, or I'm just interested in my anxiety and my life space. And the way it's designed is that the doctor or the patient could choose which things they want to monitor and track those. And once people are able to get detailed information about the things they need, then the treatment can be personalised towards them. We think it's also got real value as a clinical outcome measure. When we have treatments, we really need to see the impact of those treatments, so good and bad. If a treatment is something that you have to attend every day and spend 3 hours doing, that's going to change the way that your life is rolling out at the time. So you might see improvements in one area, but losses in another. And this lets us have a good look at how treatments are for people.